Hey everyone, Diane Palacio here with the Denials and Documentation Compliance team. Today on the Right Way Wednesday we're going to talk about cognitive retraining. So last week Nicole addressed the diagnosis code of symbolic dysfunction. I'd like to expand on this theme a little bit and talk specifically about cognitive retraining. Often our residents will present with both cognitive and language deficits that impact communication, independence, and quality of life. So when do we bill for 97532, which is cognitive skills development, and when do we bill for 92507, which is the treatment of speech, language, voice, communication, and/or auditory processing disorders, and when do we bill for something completely different like 97535, which is self-care retraining? 97532 is the cognitive skills development code and is used for restoring cognitive status following a traumatic brain injury. It is not appropriate at all for those residents that have a progressive neurological disease. Cognitive retraining may be medically necessary for patients with acquired cognitive deficits resulting from head trauma or acute neurological events such as cerebrovascular accidents. Impaired functions may include, but are not limited to, the ability to follow simple commands, attention to task, problem-solving skills, memory, ability to follow numerous steps, ability to follow logical sequence, and so on and so forth. Conditions, however, without the potential for improvement or restoration, such as chronic progressive brain conditions, would not be appropriate for this code and the associated types of interventions. Evidence-based reviews indicate that cognitive rehabilitation, and specifically memory rehabilitation, is not recommended for patients with severe cognitive dysfunction. Cognitive skill retraining should be aimed towards improving or restoring specific functions which were impaired by an identified acute illness or injury, and their expected outcome should be reasonably attainable to the patient as specified by the plan of care. What does this mean? Well, simply put, we aren't working to restore cognitive function in a resident with dementia. We are working to compensate for the loss of that function through various techniques designed to allow the resident to adapt or function more optimally in his or her environment. Thus, cognitive retraining would not be an appropriate code to bill for a patient with these types of deficits as seen in chronic neurological conditions. Cognitive skills are, however, an important component of many tasks, and the techniques used to improve cognitive functioning are integral to the broader impairment being addressed. Speech-language pathologists would thus bill any training related to the cognitive component of language to speech and language training, which is 92507. This code includes the treatment delivered for disorders of speech, articulation, fluency, voice, and language skills, as well as for impairments of cognition, language, and pragmatics found in cognitive communication disorders. Occupational therapists can also work on cognitive impairments. Specifically, their focus would be on how those impairments affect their ability to perform their ADLs. So in these cases, it is probably more appropriate as an occupational therapist to bill 92535 ADL training as we focus on the cognitive components of the task that are essential to autonomy or independence or the goal that we have set. So typically as an occupational therapist, if we are not treating specific cognitive deficits and it is not an acute brain injury type patient, we would bill the most appropriate code associated with the skills that we're trying to develop in that resident. For example, working to improve sequencing of dressing tasks, we would bill this as 97535. It is skill treatment which is focused on dressing tasks as the ultimate outcome. If you need any additional guidance, check out our Occupational Therapy LCD for cognitive retraining and our Speech Therapy LCDs for guidance on cognitive retraining tools as well. In addition, we can refer to resources on ASHA and AOTA for specific guidance related to these codes. As always, you can feel free to email the Denials and Documentation Compliance team at denials@heritage-healthcare.com. And also don't forget to reach out to us on our Facebook page, Documentation Success. Feel free to ask your questions there. We look forward to helping you with any questions you may have related to cognitive retraining, and we hope that this has been helpful to you. Thanks, and have a great day.